Canada's senior population is projected to see unprecedented growth in the coming decades, and experts say new housing strategies are needed now, and that includes rethinking how neighborhoods are built. CTV's Scott Hurst is standing by with the latest on this. Good morning, Scott. What are the trends that we are seeing in the shifting demographics in the country?
Good morning, Akshay. Within about the next decade, a quarter of the Canadian population will be over the age of 65, and within the next 2 decades, the total population of seniors in Canada will have surpassed 11 million, which is why advocates say a new policy is needed for how seniors are living over the next few decades. And this shouldn't just be a seniors issue. Of course, this is us. These are our viewers. And if you're not in this age demographic, these are your parents. These are your grandparents. And this will require a significant shift in how healthcare is distributed, how housing is built. Advocates say seniors need more diverse and affordable housing options and are calling for a national seniors strategy that includes allowing seniors to continue to be independent while still engaged in their communities, lead healthy and active lifestyles, have closer care to home, and more support for their caregivers, which often end up being unpaid caregivers, and that ends up being these kids and grandkids of seniors. So as this population booms, Akshay, there is a demand and a need for new housing strategies, and that doesn't just include, but it does need a significant investment in seniors living at home who can stay at home with their partner and as they continue to age independently. So there is much investment that's needed in allowing seniors to stay in their homes, but also they say we need to rethink how entire neighborhoods are built over the next few decades, Akshay.
So are there places Canada can look into, for example, in how to deal with the current issue?
Actually, these advocates point to a few areas specifically around the globe. One is Scandinavia, where their population already skews a bit older, and they've really adopted and invested in the co-housing model. Of course, we have seniors and retirement communities here in Canada, and we also have nursing homes, but there needs to be an investment, a greater investment, because advocates say there is a significant gap, and Canada is slow to develop this co-housing model. And there's that gap between staying at home and going to round-the-clock care in nursing homes. So these co-housing models allow seniors to live independently in private homes and apartments, but have a whole host of amenities attached to their buildings, attached and integrated into their communities, including home care services, shared dining and meals, and other recreational activities. And so this allows Canadians to still age independently, but also have the resources they need over the next few decades and allow this to change as they age as well. Of course, what you need at 65 is different from 75, 85, and 95. Seniors are also living longer, Akshay, and their needs change over time.
Indeed. CTV's Scott Hurst from Toronto. Appreciate that update, Scott. Thank you.
Thank you.